Hello, guys. I am Dr. Vishnu, and I am back with another interesting concept, and that is regarding antipsychotics. Antipsychotics are also known as neuroleptics. These are those medicines which are given for conditions like schizophrenia and psychosis related conditions, but they have other indications also. We will talk about that later. Actually, this presentation is very long because antipsychotics are those medicines which have a variety of side effects, and they are a large number of medicines as well. Obviously, in this presentation, we can't explain the details of each and every medicine. Our main focus is to make sure that you get practical knowledge from most of the medicines that you commonly see in your hospital when you are working in the hospital or when you are working on case studies, and also about some newer medicines that have come into the market, which you may not be able to know. So here we are going to talk about antipsychotics. This presentation is divided into two segments, so we will come into that later. So as our channel always feels very proud about that we are in the progress of making practical knowledge oriented videos, because theory, as our motto of our channel is, theory is available in books, it is available in websites, it's available in people's notes, PowerPoint, slides, etc. But practical knowledge is something that is not easily understood by everyone. So here we are focusing on giving practical knowledge to everyone at the comfort of their phones, and especially for those people who are not getting exposure to particular departments in their hospital or who are not exactly sure of what to do in their career. So this presentation is divided into two videos. So part one video I will be talking about today, and the next part will be uploaded the next day. So please subscribe and definitely follow our channel to get the part two video. So actually the main intention of making two parts is that it will make me explain things better without keeping track of the time that I'm consuming. So here there will be 10 things that I will be explaining. One is the dopamine hypothesis. Then we have the serotonin hypothesis, correlation of antipsychotic potency with side effects, receptor pharmacology, treatment guidelines for schizophrenia. So these are the 5 things that we will be talking about today. Then the remaining 5, that is the side effects of antipsychotics, which is very big, route of administration of antipsychotics, what are the newer molecules or what are the newer advancements that have happened regarding antipsychotics, what are the common uses of antipsychotics, and definitely 1 or 2 mnemonics that can be easy to remember. Actually, I have referred this mnemonic from a book. I found it very interesting, so I just thought that I will share that with you. So this video is divided into part 1 and part 2. So part 1, I'll be talking about today. So first we come to the dopamine hypothesis. Basically, whenever we talk about schizophrenia, as you know, schizophrenia is one of the most devastating and one of the most serious psychiatric disorders, which is characterized by hallucination, which is characterized by delusion, and definitely it affects your day-to-day life and your interaction with people. Because when you are having hallucination, that is literally very, very dangerous, because hallucination is a condition in which you are seeing things or you are thinking about things which has nothing to do with reality. So when you are seeing or listening things that have nothing to do with reality, you start behaving abnormal. And your abnormal behavior will isolate you from others, maybe even your family, from the society. So all these things have a devastating effect on your psychosocial well-being. So schizophrenia, always remember that it is a lifelong disease. It is incurable. Yes, treatments are available. There are a lot of molecules which have shown promising results. And definitely you can improve your quality of life with psychiatric counseling, maintaining your day-to-day life activities, and definitely taking medicines at the proper time. But this disease is incurable. And the interesting part of this disease is that we exactly cannot predict what a person is thinking at a particular time. Always remember, whenever you have a disease in any part of your body, you can predict how it happened. For example, if you're having gastroesophageal reflux disease, you can predict how it happened. If you are having any other kind of arthritis or anything like that, you can say how it happened. And you can at least predict what will happen. Even if you cannot predict how it happened, there are some conditions where you can't predict how it happened, but at least you will be able to know what will be the outcome or what can be the future consequences. But there is one particular organ that is known as the human brain, which is unpredictable. And you know that our world is like that. So many things are happening all around the world. So many unfortunate events are happening. So it is a tag of unpredictability, because the human brain can think in such notorious way that a person cannot even think that how he could think of like that. And that is why schizophrenia, most of the psychiatric disorders, especially schizophrenia, is very unpredictable. We exactly cannot tell what the person might behave. And that is why the treatment strategy for this disease should be very aggressive, and at the same time, a lot of emotional and psychosocial support this kind of patients require, so that they don't turn out to be notorious. Exactly, we don't have a perfect reason as to why schizophrenia happens. But yes, we have reasons for psychosis. There can be various reasons why you can develop psychosis. For example, you had a childhood trauma, or maybe you were abused in your childhood, or something very, very demotivating happened in your childhood, and you started hating people because of that. That can also lead to some kind of psychotic behavior or aggressive behavior. When you were born, if there were some kind of damage to your brain, or if the oxygen supply to your brain was reduced, it is known as cerebral anoxia. In that condition also, it has been hypothesized that you may have this disease. If you are having any kind of infection that affects the brain, for example, it can be encephalitis or meningitis, or any kind of infection affecting the brain. It can be HIV associated also. And if it has done significant damage, in that condition also, you may get this problem in the long term. And definitely there are a lot of medications that cause psychosis. Necessarily, it may not cause schizophrenia, but definitely it will cause psychosis. So if you are taking any kind of CNS stimulant, like for example, LSD, or if you are taking any kind of like amphetamines, all this narcotics or drug abuse, especially they are CNS stimulants. In that condition also, you may get psychosis. So these are some of the reasons. There are a lot of reasons. There are genetic problems also associated. So let us come to the three major hypotheses which actually has been postulated to be implicated in schizophrenia. So the first hypothesis is the dopamine hypothesis. Always remember that dopamine is very important, because it is also known as the pleasure hormone. It is also known as the rewarding hormone, because you feel good about yourself because of dopamine. You feel excited about something because of dopamine. Whatever pleasure related activities you do, all those things are related to dopamine. But if this dopamine level rises too much, then it can cause schizophrenia. So that is why whatever medicines we give for schizophrenia, their main intention is to control the level of dopamine in the brain. So when I'm talking about dopamine hypothesis, I have to say another thing also. Schizophrenia is divided based on dopamine activity into two types. One is called positive schizophrenia, and the other is called negative schizophrenia. Positive schizophrenia happens when dopamine level is too high. So in that condition, you can get aggressive behavior, you can get hallucinations, you can get paranoid, you can have delusions. Delusions means unnecessary doubting of people, confused state of mind, all these things. And negative schizophrenia means dopamine level is too low. So in that condition, what happens? As I said before, dopamine makes you feel good about yourself. So if negative symptoms occur, This kind of people will not prefer to mingle with people. This kind of people will always want to sit in a room alone and isolated. It is known as flat effect. This kind of people will always be very depressed. They will never feel good about themselves. And suicidal tendencies have also been reported if dopamine level is too low, because you are not feeling good about yourself. So that is why we have to be very careful when we treat patients with schizophrenia, because if we are directly reducing dopamine level for a very long time to treat psychosis, that can lead to depression as well. So we have to be very careful, and the proper managing of patient with psychosocial counseling, and at the same time proper medicines should be given so that the patient can live a good quality of life. So the dopamine hypothesis says that increased amount of dopamine, which is found in the limbic system of psychotic patients, can lead to psychosis. So this was actually the first hypothesis, that it was found that in psychotic patients, in their limbic system, large amount of dopamine was found. And this dopamine usually acts on dopamine type 2 receptors. We have actually 5 receptors of dopamine: D1, D2, D3, D4, D5. D2 and D3 are the major receptors that are involved in schizophrenia. So their overactivity leads to psychotic symptoms, especially D2. So that is why some medicines were discovered which possibly blocks D2 pathway, or which blocks the D2 receptors. So the first class of medicines were synthesized to be D2 antagonist. Antagonist means blockers. So they are known as typical antipsychotics. So always remember, the first medicines for schizophrenia were typical antipsychotics. Now we come to serotonin hypothesis. So actually some researchers were doing a study on LSD. LSD, you know very well, it is a very powerful hallucinogenic. So it was accidentally found. Actually, they were trying to research something else, but they accidentally found that in the urine sample of patients who had taken LSD, large amounts of serotonin were found. 5-HT means 5-hydroxytryptamine, which is also known as serotonin. So then the next hypothesis came that LSD is a hallucinogen. So definitely it will cause psychosis. LSD increases 5-HT, that is serotonin level. So that has a possible connection with psychosis. And that is why the second generation antipsychotics came, which are known as atypical antipsychotics. So they mainly block 5-HT2A receptors, but they have effects on other receptors also. We'll talk about that later. Later, when research was conducted on atypical antipsychotics, it was found that they block D2 receptors also. But definitely, they were not so powerful blockers of D2 as typical antipsychotics, but atypical also blocks D2. So that is why we have classified antipsychotics into major 2 categories. One is called typical antipsychotics, which usually acts on D2 receptors. And one is called atypical antipsychotics, which acts on dopamine receptors as well, and serotonin receptors much more. Aripiprazole and brexpiprazole are 2 special molecules. I personally say that there should be a third class of antipsychotic also, and that name should be SDAM. If you want, you can note it down somewhere when you listen to what I say. SDAM, serotonin dopamine activity modulators. Till now, whatever antipsychotics we were talking about, they were antagonist. Antagonist means they directly block it. But modulator means you are not allowing the level to rise too much, and you are not allowing the level to fall too much. So it is called management. Modulation means management. So aripiprazole and brexpiprazole have that particular characteristic that they are partial agonists at D2 receptors. So that is why I believe that there should be a third class of antipsychotic, and its name should be SDAM. Although aripiprazole and brexpiprazole come under atypical, but I believe they are a bit different. Aripiprazole, brexpiprazole, ziprasidone, and clozapine, they are partial agonists at 5-HT1A receptors also. That means they activate 5-HT1A receptors also. So what happens in 5-HT1A when it gets activated, we will see in future slides. So you can easily understand what will be the pharmacological effects of these medicines when they activate 5-HT1A receptors. And quetiapine blocks alpha-2 receptors. That is a specialty of quetiapine. And I will come to that also. When alpha-2 receptors are blocked, what happens? The biggest problem that we currently face in our study, I don't exactly know who is watching this and which background you belong to, which medical background you belong to. But I personally believe that the biggest problem that we face currently is we study the mechanism of action of all medicines, but we don't study the mechanism of side effect of all medicines. Like, for example, if somebody asks you, what is the mechanism of action of antipsychotic? You will say that it blocks dopamine, it blocks serotonin. But we don't know what are the side effects that can happen when dopamine is blocked and serotonin is blocked. So that is called receptor pharmacology. So first of all, you should understand which are the different receptors in our body, what are their functions. So you can easily predict by your own that what will happen if a particular receptor is activated and what will happen if a particular receptor is blocked. So this is also my motive of sharing this information in social platform. And I believe that let this message go to maximum people. There are a lot of people around who are struggling with their memory, who exactly don't know how to study. They are just studying because of the rules and regulations of the educational system they are inside, just to get the marks, to clear the exam, to get a pass certificate. That's it. Beyond that, they are not able to apply or understand or think creatively. Now we come to the correlation of potency with ADR. So this is actually applicable to first generation antipsychotics. Always remember, first generation antipsychotics are also known as typical antipsychotics, and typical antipsychotics are classified based on the potency into two. The first is known as low potency antipsychotics, and the second is known as high potency antipsychotics. Low potency antipsychotics have less affinity towards dopamine receptors, but have high affinity towards all the other receptors. For example, as I have written here, low potency antipsychotics will have low affinity towards the dopamine receptor, but they will block alpha-1 receptor, they will block histamine type 1 receptor, they will block muscarinic receptors also. Muscarinic means it is related to acetylcholine. But the high potency typical antipsychotics, they mainly act against dopamine receptors, and they do not act on all the other receptors that I said right now, muscarinic, histaminergic, or alpha-1. So the side effect of these medications will differ depending on the potency. So highly potent typical antipsychotics, examples are written here: haloperidol, fenfluridol, flufenazine, thiothixin, etc. They are preferential towards dopamine receptors. And the low potency typical antipsychotics, for example, thioridazine, chlorpromazine, mesoridazine, etc., they are preferential towards muscarinic, histaminic, and alpha-1 receptors. Now we come to the most important part, and I believe that this will be good for you if you are studying antipsychotics, if you are studying depression, if you are studying bipolar disorder to some extent. This table will be useful for you. And it is not just for that. You can understand in general also what are the side effects that can happen if a particular receptor is activated and if a particular receptor is blocked. So this is the practical knowledge that I want to share with people. And this is exactly the motive of our channel. Let's come to the first receptor, 5-HT1A receptor. If it is activated, means if any medicine is activating 5-HT1A receptor, what will happen? It has antidepressant activity. It has anti-anxiety activity, but it reduces your blood pressure. So you can understand, so you can make a practical knowledge of your own that if any molecule is activating 5-HT1A receptors, its side effect can be dizziness. Its side effect can be orthostasis because it causes hypotension. When you are having hypotension, definitely you will have dizziness. And it also causes bradycardia. Bradycardia means reduced heart rate. So now you can predict if any molecule blocks 5-HT1A receptors, what will happen? So if it is blocking, then it will increase the risk of depression. It will increase the risk of anxiety. It will increase your blood pressure, and it will increase your heart rate also. So this is how simple it is. You just have to understand what a particular receptor function is in our body, which are the molecules that activate it, which are the molecules that block it. Now we come to 5-HT2A receptors. So 5-HT2A, if it is activated, it causes anxiety. It causes insomnia. So if you are taking any medicine and if you are reading in its pharmacological actions that it activates 5-HT2A receptors, you should be careful because it can cause insomnia. You will not feel sleepy. And definitely it causes sexual dysfunction. So if any couple is, any one of the couple or both of them are taking this medicine, any medicine that activates 5-HT2A receptors, and they are planning to have a child, then it can be a problem for them. If 5-HT2A receptors are blocked, then the opposite things happen. It will cause anti-anxiety. That means it will reduce your anxiety. Insomnia, the opposite of insomnia is sedation or sleep. So it will improve your sleep. And sexual dysfunction, the opposite is it will increase your sexual activity, or it will reduce the sexual dysfunction that you are suffering from. Now we come to 5-HT2C receptors. If it is activated, it causes anxiety. It causes anorexia. Anorexia means you will not feel hungry. And definitely when you will not feel hungry, you will not feel to eat food. And when you are not eating food properly, there is always a chance of your weight getting reduced. So that is why when 5-HT2C receptors are activated, it can cause weight loss. It can also cause sexual dysfunction. The reason is already written in point number 5, reduced dopamine activity. I already told you, whatever feelings you are having inside you, whether it is excitement, whether it is sexual feelings, whether it is gambling tendency, whatever feelings, whatever thing that you are feeling good about yourself, it is because of dopamine. So when dopamine is reduced, all these things will get reduced. So if 5-HT2C receptors are blocked, then the opposite things happen as what I said right now. Now we come to 5-HT3 receptors. I hope you know already there are medicines that block 5-HT3 receptors. For example, ondansetron. So 5-HT3 receptor, when it gets activated, it causes nausea. It causes GI problems. So that is why we give ondansetron, palonosetron, whatever medicines, granisetron, etc. medicines. So they are blockers of 5-HT3 receptors. So they have antiemetic activity and they reduce GI problems also when it is blocked. Now we come to NE. NE means noradrenaline, also known as norepinephrine. Always remember, whenever we talk about depression, a person can go into depression if 3 things are reduced. Number 1 is serotonin, number 2 is norepinephrine, and number 3 is dopamine. If these 3 things are reduced, then definitely the person will go into clinical depression. So noradrenaline receptors, if they are activated, it will improve your depression. So it will cause antidepressant activity. But the problem is that noradrenaline, whenever it increases in your body, it can increase your blood pressure because it is a part of adrenergic nervous system. So it will increase your blood pressure. It can cause tremor. Tremor means trembling of the fingers or trembling of the hand. It can cause sweating and it can cause hypertension. So when noradrenaline is blocked, if any molecule is blocking noradrenaline, then the opposite effects will be observed. If alpha-1 receptors is activated, it increases your sexual activity. So if alpha-1 receptors are blocked, it causes sexual dysfunction. That is why most of the alpha-1 blockers have sexual dysfunction as a side effect. or any molecule that has an antagonistic effect on alpha-1 receptor will cause sexual dysfunction as a side effect. You can yourself search literature, you can yourself refer it, you will find it out. Alpha-1 receptors increase noradrenaline. So definitely it will cause hypertension, it will cause tachycardia. So when we are blocking alpha-1 receptors, so it will cause bradycardia, it will cause hypotension. Then we have 5-HT7 receptors. So if it is activated, it causes depression and it can cause abnormalities in glutamate. So we will come to the third hypothesis, and that is called glutamate hypothesis. We'll talk about that later. And when 5-HT7 receptors are blocked, it improves your depression and it also controls the level of glutamate in the CNS. And this is very, very simple. The last one, many of you may be taking this medicines also. You know about many antihistamines. For example, cetirizine. We have so many medicines that actually are antihistaminics. When you have allergy, when you have food allergy or dust allergy, any kind of allergy, we usually take antihistaminics. So why do we take antihistaminics? Because histamine increases the allergy, histamine increases the secretion from the nose, so it makes you feel discomfort. So when you take an antihistamine, it blocks all these secretions and it blocks the response to the allergy as well. So when H1 receptor is activated, it makes you alert. If H1 receptor is activated, it causes weight loss. And if H1 receptors are activated, it causes allergy. I hope you know very well that histamine is associated with allergy. So when you are taking antihistaminics, what can happen? It will make you sedated. That is why most of the antihistamines, it is preferred to be taken at night time, unless it is very, very urgent to be taken at other time of the day. Because if you are taking an antihistamine, it will make you sedated. Depending on the potency, it will make you sedated, it will make you feel tired or sleepy. So if you are taking it at night time, it is best, so that anyways you are going to sleep, so it will improve your sleep. If you are taking H1 blocker, histamine type 1 blocker, it can increase your weight. And yes, it has a beneficial effect. It has anti-allergic potency. So these are some of the examples that I mentioned here. So now when you study any medicine in your life, and if it has activity on any of these receptors, you can predict yourself what the possible effects may be. Now we come to the treatment guideline for schizophrenia. So if a person is diagnosed with schizophrenia, what are the things that we need to do? If a patient is diagnosed with schizophrenia, we usually start with atypical antipsychotics. And the reason of starting atypical is that the side effects of atypical are much more tolerable in comparison to typical antipsychotics. Obviously, it is not that atypical are very safe. They also have their own list of problems, but still it is quite tolerable and quite manageable in the long run in comparison to typical antipsychotics. And please remember, if we are using atypical antipsychotic, don't start with olanzapine or clozapine, because olanzapine has its own different kind of risks. It can increase the risk of stroke. It can cause new onset diabetes mellitus. A lot of problems are there with olanzapine. And clozapine is a very, very dangerous medicine. Anyways, there is a particular slide on clozapine that I will like to talk about later. So clozapine is also a molecule that requires therapeutic drug monitoring. And that is why only in the last stage we give clozapine. So we can start with any atypical antipsychotic except olanzapine and clozapine. If there is no response even after 6 weeks, for example, you are using that medicine for 6 weeks and there is no beneficial effect. In that condition, we can switch over to any other atypical antipsychotic. Any other means which one you were using before, you have to stop that and we will switch over to any other atypical antipsychotic. Again, except olanzapine and clozapine. Again, if there is no response, then we switch over to typical antipsychotic. Usually the drug of choice is haloperidol or flufenazine. This is what usually is given. Even then also there is no response, then it is known as resistant schizophrenia. Resistance means, or it is also known as refractory schizophrenia. So it is a condition in which multiple drug therapies are not working in the patient. In that condition, the drug of choice, DOC means drug of choice, is clozapine. And even with clozapine also, if there is no response, then we have to go for electroconvulsive therapy, which is quite complicated. So this is just a summary of a treatment guideline for schizophrenia. And later then we will be talking about the individual molecules, what are the side effects, and what are the interesting things that we can know. Even if we are not seeing it in the market, still, even if we are not seeing it commonly in the hospitals, it doesn't mean that we should not know about them. So what are the important practical things that we can know about them? We will see to it later. So this is the next slide. I am stopping here. This is the part 1 video. In the next part, we will be talking about the side effects of antipsychotics. We will be talking about the indications of antipsychotics. We will be talking about what are the newer advancements in pharmacy or in medicine with regards to antipsychotics. And a lot of things we will be discussing in the next part of the video. So please do share and subscribe so that when the next video, that is the part 2 of this video comes, we will talk about the remaining part of antipsychotics and you will get a good idea about what I am trying to convey. So that's it. Thank you very much for listening to us, and I wish you all the best in your career perspectives. If you have any kinds of doubts, you are struggling in your studies or any kind of problem, please feel free to contact us. We have our Instagram channel. We have our Telegram channel as well. And definitely please do post your views in the comment section. If you want me to talk on any particular topic, which can be good for practical perspective, you can drop the titles of those topics also in the comment section. We will definitely consider. Thank you so much.